Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minger, and I'm so glad you're listening today. On today's episode, we're going to talk about the importance of working with a team of healthcare professionals to meet your fertility and cycle-related goals. Now, so often I talk about stories where I work with an individual with a particular problem. We sort through their diagnosis and treatment plan, and within a few months, they're back on track and all is well with the world. Unfortunately, this isn't always the case, and many times I do need to bring in other healthcare professionals, whether that's people that work directly with me, or that may be an extra specialist who can evaluate the more intricate needs of a particular client. So I wanted to take some time today to share a little bit more about a patient story that involves bringing in the right people at the right time that extends just beyond the care that we were providing at my clinic. Today's patient story is about someone who we'll call Claire. Now, Claire came to work with us because she was having really irregular cycles. Her period was only happening once every 4 to 5 months. She had significant problems with her weight as well as facial hair growth. She had lots of irritability, and for many, many years, she had been placed on the birth control pill because she was trying to avoid pregnancy. However, about 6 months before coming to see me, Claire and her husband decided they wanted to try and get pregnant. And so she stopped taking the birth control pill and thought that within a cycle or two, she would be pregnant. Unfortunately, Claire's cycle didn't return to normal, and she was not getting pregnant. She was always told that as soon as she stopped the birth control pill, that she'd be able to resume regular cycles again, but that just didn't happen in her case. So Claire's sister actually sent her in to start working with me. As always, we got Claire started with charting her cycles. I did our full evaluation, including an extensive lab panel, ultrasound testing, and we were able to diagnose her with polycystic ovary syndrome, or PCOS. Now, I have a whole separate episode that talks all about PCOS and how we evaluate and treat that. So go check that episode out if you want to learn more about that process. So we went through that whole evaluation with Claire, and after the course of about 2 to 3 months, we just weren't making much progress with her cycles, and her lab levels were actually still out of range. So at this point, I had a follow-up visit and discussion with Claire and her husband that since her body wasn't responding to the medication and supplements we were treating her with, it was time to get some additional focused care from other healthcare professionals that work in our area. Now, one of the important individuals that we got Claire set up with was a registered dietitian. Now, in women who have a diagnosis of PCOS, many of them deal with insulin resistance or glucose intolerance and struggle to maintain a healthy balance of their diet. By working with our registered dietitian, Claire was able to better understand how what she was eating affected her blood sugar levels, which then played a role in her ovulation and hormone function. The other individual that became vital to reaching her healthcare goals was that we got Claire working with one of our health coaches. Now, this health coach works specifically with her to focus on her personal goals. We found that through additional history taking, Claire had really poor sleep patterns. She was oftentimes getting no more than 5 to 6 hours of sleep per night. Her job as a nurse at the local hospital was shift work, and many times she would flip back and forth between working nights and days, and that really threw off her sleep schedule. She was working a job that was very stressful, which most certainly was also playing a role in her erratic sleep, as well as stress hormone levels, which were then affecting her ovulatory patterns. By working with our health coach, Claire was able to get the specific guidance she needed and set goals in order to help improve her overall health in a way that helped to manage her symptoms better. Ultimately, the extra assistance of these healthcare professionals, in addition to what we were doing through our medical treatments and charting evaluation, helped to restore Claire's cycles to more regular. So after working with the dietitian, the health coach, and personally working towards her goals, we did finally start to see changes in her cycles, which were now becoming more regular. Her body was more responsive to the supplements and the prescriptions that I was prescribing. And over the course of the next few months, Claire was able to achieve a pregnancy on her own. Now, Claire's story really helps to highlight the importance of working not only with a healthcare professional like myself who understands your cycles and charting and why that's important, but also sometimes reaching beyond to a network of individuals who have a similar intention or goal in mind for natural wellness. So, I want to take this opportunity today to talk a little bit more about some of the other people that can be incredibly important along your journey for fertility and wellness. As we had mentioned, a registered dietitian can be incredibly important for many different diagnoses when it comes to helping to correct hormonal and fertility-related imbalances. As was the case for Claire, PCOS is one common diagnosis that can benefit from the special guidance of a dietitian. Other clients who can benefit are anyone who has any type of autoimmune dysfunction. So whether that's thyroid dysfunction, diabetes, celiac disease, dairy or gluten intolerance, or other food sensitivities, it can be really beneficial to work with a registered dietitian to help address not only those food sensitivities, but the underlying inflammation that can occur if you're consuming some of these foods that may actually be causing you other problems. The other part, as far as health coaching that can be really beneficial, is the individual goal setting for your unique situation. A skilled health coach will go through the process of what we call motivational interviewing to help you identify particular areas that we set some goals on to help improve your quality life in a way that positively impacts your overall health. I have had my clients work with health coaches over the years and really have found it's important to have somebody who understands things from a female wellness standpoint, but also from the goal of restoring your natural cycle and improving your fertility. Working with somebody who can help you to achieve the health goals that you want to reach is of critical importance, not just for your hormones, but also for your overall mental health and well-being. The other type of coaching that we provide through our clinic is hormone coaching, which is a great opportunity for women who want a better understanding not only of what hormones are, but also how they are impacted by your hormones on a day-to-day basis. Hormone coaching helps women to realize where their physical or mental symptoms may align with where they are in their menstrual cycle, and helps them to gain a greater awareness of how they could help improve things in a more natural way. Some of our clients start off with hormone coaching from the standpoint of being able to understand what we talk about with fertility awareness with charting, and then many of them end up going on to learn more about their cycles by actually learning a fertility awareness method and doing the charting themselves. Sometimes this leads to needing to see me from a medical standpoint for the concerns that they are now able to recognize because of that hormone coaching that they had done initially. Another healthcare professional that we will oftentimes recommend for our clients is for acupuncture. Now, some people tell me, absolutely not. There's no way I can do the needle thing. But there have been some great studies done that show the benefit of acupuncture in many areas, but specifically in regards to women's menstrual cycle concerns and fertility. In our area, we have an awesome healthcare professional who provides fertility-focused acupuncture, and she has certain techniques that she does timed with your cycle, depending upon where you're at in your cycle, as well as what your intentions are from a fertility standpoint. The other specialist that is crucial to many of my clients is a mental health care professional. Many people that are going through menstrual cycle irregularities, and especially people that are dealing with infertility, can become incredibly frustrated or overwhelmed with the whole process. From the challenge of finding a physician who will actually address your concerns, to how long it takes to learn charting and get a proper diagnosis, to dealing with the frustrations of the financial burden, fear, and managing side effects of medications, the fertility journey can be long and trying. Being able to work with somebody who specializes in mental health support during this time can be so incredibly vital, not only for my clients, but for their partners as well. Now, it can be incredibly overwhelming to know, where do I even start? And one of the things that we've started to do recently is to provide our potential clients with the opportunity to schedule a free discovery call with me. This is a 20-minute conversation where we talk in general terms about your situation to determine where our services can best benefit you. We've pulled together all of these different professionals and put together something we call package-based pricing, where you can get support from all of the different people that you need for your situation for one monthly fee. And really, the goal of this is to help you to access all the services you need in one care model. We help determine which of these services are most appropriate for you, which are the most relevant, and where you can see the biggest benefit. If you are ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, where you can schedule a free discovery call with me to learn more about our package-based pricing for healthcare. We customize your treatment plan and include options to access a hormone coach, fertility awareness charting experts, a registered dietitian, a fertility acupuncture specialist, a health coach, and of course, all the medical care you need from me as a board-certified physician. We are currently able to see people for in-person appointments in the Cedar Rapids area or can arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.